Panchakarma refers to 5 therapeutic procedures that are very widely used in Ayurvedic medical practice. They form the backbone of the Ayurvedic medical service itself. They refer to 5 therapeutic procedures, and the word Panchakarma is derived from the two words Pancha meaning 5 and Karma meaning therapeutic procedure or procedures. So the Panchakarma comprises of 5 procedures which are done in specific cases. Panchakarma is used both for detoxification as a preventive healthcare mechanism as well as in the treatment of diseases, especially the more chronic ones. The whole concept of Panchakarma is quite popular nowadays, and as more and more people come across Ayurveda as part of an offering in terms of holistic healthcare. But there is a lot of misunderstanding about what Panchakarma is all about. Very often Panchakarma is misunderstood to be a whole range of Ayurvedic oil massages. Oil massages are not part of Panchakarma. In fact, oil massage is one of the preparatory procedures before an Ayurvedic doctor can perform a proper Panchakarma. The five karmas which are called as the Panchakarmas, there are 2 sets of them. Only one therapy is different in the 2. One set is called as the 5 Shodhana karmas. They comprise of Vamanam, Virechanam, Vasti, Nasyam and Raktamoksham. Vamanam means a treatment procedure whereby vomiting is induced through the administration of herbal products. Virechanam means purgation. Vasti is the process of administering medicated liquids through the rectum. Nasyam is the process wherein medicines are administered through the nostril to clean the orifices of the scalp. And lastly, Raktamokshanam is a process of eliminating impure blood. There are different methods by which the impure blood can be eliminated. They comprise of leech administration. There is also a process of venesection where a vein is cut and the patient is allowed to bleed locally. There is another process called prachanam where small pricks are made in the localized area, especially used in skin diseases and so on. However, Raktamokshanam is not a procedure which is done as a preventive or as a routine procedure for all patients. Whereas the other 4 karmas, with the difference that the vastis are of 2 types. One is an oil-based vasti, which is called as a sneha vasti, and a decoction-based vasti, which is known as an asthavana or a kashaya vasti. So the 5 karmas which are to be done as a routine for the upkeep of health comprises of vamana, virechana, asthavana, anvasana and nasya. The medical school of Ayurveda headed by Charaka called this set of 5 procedures as Panchakarma, while the surgical school headed by Sushruta they don't classify the 2 vastis as separate, club them into one and include Raktamokshana as the 5th Panchakarma. But however, as I said earlier, it is the former or the school of medicine whose recommendation of the 5 kriyas are to be done as a regular practice for people to retain their health and to prevent diseases from manifesting. It is these Panchakarmas which offer the most holistic form of detoxification and anti-degenerative therapy to the body, which is what bestows Ayurveda with some unique advantages in handling chronic diseases as well as a preventive healthcare system. The concept is like this, that the body continuously is exposed to toxins through food, through the environment and so on and so forth. Toxins are also created in the process of metabolism that is going on in the body. The body has an intrinsic ability to detoxify itself, and the liver is the most important organ that enables the process of detoxification. That's how we are not easily affected by toxins that we are exposed to on a regular basis. When the toxins are just absorbed from the gut, they pass through the liver, and the liver immediately detoxifies a lot of them, the dead bacteria and the several toxins that are ingested through food. Through the first pass through the liver itself, many of them are metabolized. and several of them, and the liver has got a detoxification system to take care of them. However, there are several chemicals which do not get detoxified at just the initial passing through the body. There are specifically toxins that are not water soluble, toxins that are predominantly lipid soluble, which are more difficult for the body to handle. In fact, the body does have ability to detoxify these toxins as well, as long as they are in circulation. But this process of detoxification takes place only in certain situations, especially when a person is in a very stressful state and does not have adequate sleep. These toxins do not get thrown out of the body, and from the circulatory system they get deposited into the tissues of the body. These toxins get stagnated in the tissues, and thereafter detoxifying them is not very easy. It is this sort of toxicity that gradually accumulates in the system that is responsible for several chronic diseases. Ayurveda therefore has a very elaborate system of detoxifying the body at a cellular level from the toxins that have been deposited in the cells over a period of time. And it recommends the administration of the Panchakarma as a preventive mechanism in order to prevent diseases that are caused by the accumulation of toxins in the tissues. Panchakarma starts with the natural observation of how the body throws out toxins which are produced in excess quantity. The toxins that are generated by the excess action of kapha are naturally eliminated by the body through the process of vomiting, which is evident in the case of children when they contract respiratory diseases which are primarily caused due to excess kapha. The child throws up, and the process of throwing up itself helps the child get rid of that problem, and the child is at ease soon after throwing up. This could probably have been a natural observation which led to the finding that toxins that are generated due to the imbalance in kapha can be eliminated from the body through the process of medically induced vomiting. So also when the pitta function increases in the body, as what happens when somebody takes extremely spicy food for a prolonged period of time, the patient is highly prone to have purgation. And the purgation is a natural process that the body adopts to eliminate the excess pitta that is accumulated in the body. Therefore, Ayurveda uses purgation or virechana as a process to reduce the exaggerated pitta in the body. These are the natural processes in the body. However, vata is a very subtle dosha which is generally not eliminated by the body, and therefore the most unique of the Panchakarma therapies is Vasti. Vasti, both comprising of the oil-based Vastis which are called as the Sneha Vastis or Anuvasana, and the decoction-based Vastis which are called as Asthapana, are used in tandem. Either of them is not supposed to be used continuously, and they need to be interspersed, so that because they are of the opposite nature. One is oily in nature and the other one creates dryness, the opposite of the oily nature. Either of them is not supposed to be used continuously, but they are supposed to be used in tandem, one after the other. So there are protocols that have been advised in Ayurveda on how to subject somebody to continuous vastis. There are procedures called Yoga Vasti, Kala Vasti, Karma Vasti and so on, where a number of vastis are given on subsequent days. These processes are very, very capable of eliminating the toxicity that arise out of the imbalance in the functioning of vata. The next and the last one, which is nasya, is very critical because the urdhvanga or the head is the side which accommodates the brain as well as all the sense organs. And so there is a specific process to eliminate toxins that accumulate in the urdhvanga by this process of nasya, where certain medicated oils and other products are administered through the nostril, and they detoxify the toxins that are locally accumulated in the skull and in the brain, and not in the brain but in the upper part of the body. The doshas that are accumulating in the upper part of the body can be eliminated through nasya. There is also nasya that is strengthening in nature to keep the body, to keep the nerves and the nervous system in a state of health. Nasya as a procedure of preventive health care is recommended as a daily procedure as well. But that nasya is of a different nature, where a small quantity, that is 1 to 2 drops of a medicated oil, is recommended to be used, whereas the nasya, which is detoxifying in nature, is of a larger dose and is meant to take away the toxins that have accumulated in the system. So these are the 5 procedures that are recommended in Ayurveda as a fundamental treatment process to prevent diseases from occurring. These are also used according to the situation in most of the chronic diseases, because the toxicity is understood to be an underlying fundamental cause of disease. And so one is expected to detoxify the body before we balance the functions of the Vata, Pitta and Kapha in order to re-establish health in a patient. This is more so in the cases of more severe diseases. Ayurveda specifically says diseases that are just corrected through balancing the doshas through a process called shamana are likely to recur, whereas diseases that are cured through the process of shodhana do not tend to recur. So that's the sort of importance that is given to the Panchakarma in the treatment of chronic diseases. In many cases, before Panchakarma is directly administered, there are certain preparatory procedures which are called as Snehana and Swedana. Snehana is the process of inducing lipid-based products like ghee, oils and so on, the fat-based substances in large quantities in the body. The high quantity of fat permeates every cell in the body, and it creates a sort of a situation in the cells where the toxins, which are fat soluble, are then thrown out by the cells. Modern science has evidence to show that when the level of lipids in the cells increase, different nuclear receptors like LXR receptors get triggered, and that leads to the excretion of fat from the cells into the system, and parallelly also it stimulates bile synthesis and prevents bile reabsorption from the intestine. So we find that there is a whole lot of biochemical changes that takes place in the body when fats are administered in large quantities, as is done in the Snehana Karma in Ayurveda. It is very interesting to note that when we administer large volumes of these fats, as described in the textual protocol in large doses, we find that not only the disease comes down, the patient's lipid profile as well improves, because the body detects the excess of lipids that are administered and the body throws out fat through the fecus. So we can actually experience that after a course of the shodhana, the snehana or the oiling that is done for the purpose of shodhana, which is done in large quantities, that the lipid profile as well improves. So this actually enables the body to start excreting the toxins that are internalized in the cells and which have been staying there, forming a difficulty on the part of the body to excrete those toxins. So this sort of a process is triggered by this large volume of fats that are administered in the process of snehana. And then we administer swedana, which is a process of inducing sweating. Sweating is induced when the circulation is stimulated. And when circulation is stimulated, the toxins that are excreted by the cells are carried very, very well to the liver, and then the liver is able to detoxify the substances and make them ready to be excreted by the body. So in several cases where the toxicity is not in circulation but is already been internalized into the cells and is of a chronic nature, one needs to go through the process of snehana and swedana before one undergoes Panchakarma. In the hands of an experienced Ayurvedic physician, these are magic. Panchakarma done in the proper manner creates extremely unimaginable results in patients. Ayurveda calls Vasti as Niruha. Niruha means one cannot guess the extent of efficacy that can be produced by properly administered Vasti or enema. So this is what Ayurveda really uses in the treatment of several chronic non-communicable diseases and lifestyle related diseases, especially the degenerative diseases which are the bane of society today. So that is the avenue where Ayurveda has a whole range of things to be done as a preventive as well as a curative intervention for the current day health needs of the society. So Panchakarma is definitely the thing for the future of health of the world. AVN Arogya Ayurvedic Hospital, 175 Villacheri Main Road, Madurai 625004, Tamil Nadu, India. Call +91 9025 700 400. URL www.avnarogya.in. Centers in Chennai, Bangalore, Mumbai, Cochin, Madurai and Malaysia.